So guys, we continue. Yes, I see. My beloveds, take your pens, papers. Today's topic is rheumatoid arthritis. Rheumatoid arthritis, the questions. I will try to clarify all the confusing points for you and suggest how to correctly answer state exam questions, my beloveds. So, yes, I remarked that some issue. You've got some issues. Let's go the confusing points. That's why you need to take pens and paper, papers and pens and pencils, up to you, to make the notes. About rheumatoid arthritis, my beloveds, rheumatoid arthritis is a chronic. It's a chronic, but systemic autoimmune disorder that primarily affects the synovial joints, causing inflammation, pain, and progressive joint destruction. So it can also involve extra articular manifestations, significantly impacting a patient's quality of life. So it's not just a synovial problem. Synovial, up to you to pronounce. Of course, primarily affects the synovial joints. That's why it's a rheumatoid arthritis. Now about sex. Of course, rheumatoid arthritis is predominantly more common in women. So women affected approximately 3 times more often than men. And interesting, with the peak of incidence occurring between the ages 30 and 50. So why it's so? Like all other autoimmune disorders, no idea. But what is clinical issue of that? So the understanding the sex difference is essential for early diagnosis and preventive care. So you need to have a so-called rheumatoid, if you want, rheumatoid arthritis vigilance, especially in women presenting with joint pains and stiffness. Do we have genetic predisposition? Yes, we do. I see this question. Because genetic predisposition plays a significant role. So the HLA-DRB1 gene is strongly associated with increased susceptibility to rheumatoid arthritis. This gene encodes for MHC, class 2 molecules, playing a crucial role in the immune response. Now, if you don't remember this MHC, it's not a huge problem, but yes, we do have genetic predisposition. And that's why they propose the genetic screening can aid in assessing risk factors, especially in patients with a family history of autoimmune diseases, not just rheumatoid arthritis, so-called family history, especially in women. What about smoking? Smoking is an environmental risk factor? Yes, it is. So cigarette smoking significantly increases the risk of developing rheumatoid arthritis, and it's associated with more severe disease progression. So why? Honestly, no idea. But what is clinical issue of that? Encouraging smoking cessation in a high risk or at risk populations is vital to reducing the incidence and severity of what? To reduce of rheumatoid arthritis. What is the hallmark of polyarthritis? It's a symmetrical polyarthritis. Symmetrical, it's a hallmark. Means, so rheumatoid arthritis typically presents with symmetrical joints involvement, particularly affecting the small joints of the hands and feet. No, hands is a principle. So clinical issue of that, and you will be asked about that, the symmetry and involvement of so-called metacarpophalangeal. I've never arrived to pronounce it correctly. MCP, metacarpophalangeal, MCP, and proximal PIP joints, interphalangeal. Metacarpophalangeal and proximal interphalangeal joints help distinguish rheumatoid arthritis or other types of arthritis. About rheumatoid factor. With rheumatoid factor, my beloved, RF, is positive Not in 100% of cases. It's approximately 70-80% of cases. Anticyclic citrullinated peptide, anti-CCP, antibodies. Now we can say more specific and can indicate more severe disease. So this anti-CCP. But don't neglect, of course, rheumatoid factor. Why not? What is clinical issue of that? Early detection of anti-CCP is crucial for prompt treatment initiation and improving long-term outcomes. About stiffness, morning stiffness. Yes, it's it's not a hallmark, but less than morning stiffness, lasts more than 1 hour. One of the key diagnostic features of rheumatoid arthritis, actually not only rheumatoid arthritis, but autoimmune disorders, is prolonged morning stiffness, often lasting more than an hour and improving with activity. What is clinical importance? This helps distinguish rheumatoid arthritis for some other type of osteoarthritis, where stiffness is typically short-lived and worsens with activity. But for metabolic disorders, it's autoimmune disorders, this morning stiffness, it's a key diagnostic feature. So extra-articular manifestations, common or not? Yes, because it's the same, my beloveds, all autoimmune disorders is actually the one disorder. But when we talk about rheumatoid arthritis, we want to say that rheumatoid signs are prevalent in this point. But because it's an autoimmune systemic disorder, it can affect such as the other organs. Lung, interstitial lung disease, heart, pericarditis, eyes, scleritis, and skin, rheumatoid nodules. So vigilance for the clinical issue, vigilance for systemic involvement is essential in patients with long-standing or severe disease. About cytokines, actually I don't know, you will be asked or not, but I heard that someone were asked about this. Yes, cytokines, such as the most common, TNF-alpha, interleukin-1, 6, play pivotal roles in a joint inflammation and destruction. So targeting these cytokines with biological therapies like TNF inhibitors has revolutionized rheumatoid arthritis management. But between us, it's a fairy tale. No, you don't answer in this manner. You said that TNF inhibitors revolutionized autoimmune disorders, especially rheumatoid arthritis management. Why not? So yes. About early and aggressive treatment. So the treat to target strategy aims for remission or low disease activity through early use of so-called DMARDs, disease-modifying anti-rheumatic drugs. So early initiation of methotrexate or biological significantly reduce joint damage and disability. Again, fairy tale. But you said yes, of course, DMARD, and TNF inhibitors, yes. Big pharma tricks. Anyway, okay, so you answer in this manner. So about radiographic changes that show joint erosion and deformity. Characteristic changes include joint space narrowing, erosions, and osteopenia near affected joints, often visible on X-rays and more sensitively detected via MRI or ultrasound. Clinical issue. Regular imaging helps monitor disease progression and treatment efficacy. So why all this matters? Rheumatoid arthritis, my beloveds, is life-threatening condition, yes, with a significant impact on a patient quality of life and functional status. Early diagnosis combined with prompt aggressive management is the key to achieving optimal outcomes. But the principal point is drinking water, a lot of water every day. Avoid sugars, fast glucose, white sugar and white meat, and physical activity. All others, it's not so important. It's just for your management of patients with rheumatoid arthritis. And don't forget about intestine. So a lot of fibers, and every day fibers, vegetables, green vegetables, grasses, fruits and vegetables, of course. Okay? water, physical activity, avoid sugar and white meal, and fibers, everyday meal. That is the point. So I clarify all, as I suppose, all confusing points. I hope it's lecture that might be helpful, will be helpful. Yes, all confusing points. I suggest how to correctly answer the state exam questions, but you have to understand that real life and exams are two different things. Once again, thanks for your attention. Don't forget to follow and subscribe my Dr. Y YouTube channel, and don't forget to follow and subscribe my Telegram Dr. Y channel. Telegram. That I've created for you, my beloveds. It's a private channel because it's not for everyone. It's not costly at all, very, very cheapy. How to find is Dr. Y in Telegram, so the same name. Y, Dr. Y, it's me, WHY. So you find this, you download in your phones or on your gadgets this Telegram, then you tap in searching mode of Telegram, Dr. Y, WHY, Dr. WHY, without question mark, of course. You find this Telegram, it's a bot, you click start and you choose your plan. Then we will talk and you will find a lot of questions, your students' cheat sheets, why not? Yes, exam questions, tickets, oral exam questions, clinical cases, etc., etc., presents, gifts, why not? So, see you in my Dr. Y Telegram channel. Stay blessed. Bye-bye.